Hi, it's Representative Larsen. I'm here at the Carl Gibson Senior Center in Everett, Washington, where we just completed a roundtable to talk about hunger programs and hunger prevention in light of Republican efforts to cut the dollars that go to the very programs that support people to keep food on their table. And with me is Rebecca Skrinde, who is with Helping Hands Food Bank in Cedar-Woolley, Washington, and serving not just Cedar, but the whole area. What is the story in Skagit County when it comes to hunger?
I've been there 10 years, and so I've seen a lot of different things happening. And right now, the most concerning thing is we are having to make really difficult decisions to kind of limit people from coming in, not allowing them to pick up for other people. It just feels shelves are a little bit low, and we still have this great more people coming in, a higher level of people, but it's the food that it just isn't coming in like it used to. And with these cuts, what I'm most afraid of is the small food banks that don't have a huge donor base and they don't go to grocery stores and pick up. They really rely on that government commodities, the big food lifeline, Northwest Harvest, for all of their food. And I'm really afraid that the farther you live away from town, the less food you're gonna get. And so I think we're kind of leaning into a crisis. I think it's been coming for a couple years, and I really believe that if we don't kind of engage in the process, meaning call people and let them know how important it is to get their voice heard, we're gonna have a tipping point where we may have to really start turning people away, which I've never done.
Help me with the question. Why don't you just turn to individual donors, private donors, to make up the difference?
Well, I think most of our people that come to the food bank are working. They are the kind of, actually maybe even middle class if we talk about inflation and all that stuff. So our donors, as government cuts, the nonprofits are going to start reaching in, of all across the board, are going to start reaching
not just food banks.
Everybody, housing, social services, medical, everybody's going to be reaching into that personal donor. And a lot of those donors opened their rainy day funds during COVID. And they called us and said, hey, I had this saved for this specific thing. And so charities are not the answer to the government's job, right? And so charities were always little ladies in the back room of a church helping people. And so the idea that we are the last resort for people that need,
fail safe,
exactly,
right,
with not a lot of support. We know that people like you support it, but your hands are being tied to actually support it. So I think that the donors want to help, and they also get so many asks from so many people, and they really lean to what's really in their heart.
Yeah. So we got a real challenge on our hands, trying to push back against these cuts, especially when it deals with healthcare, access to healthcare, access to healthy food for people, ensuring they're not kids aren't going hungry. Big challenges ahead of us. Thanks for helping me out today.
No, thank you.
Yeah, thanks.